Hi kids, welcome back to my channel. So in the age of digital pathology, I understand that many people are showing interest in pathology way more than ever before. Whether or not that's a good thing, I don't know. But I wanted to help you decide if this is a good branch for you. Okay, let's go. I'm not here to convince you that it's the best specialty. It is not for everyone for sure. But I want you to have a honest framework, like some pointers that you should consider so that you can figure out for yourself. First myth is pathologists don't work with patients. They are dealing with patients every day, which is not in the same intensity because we do not have wards. But patients are coming to us when we are giving them reports, when we are giving them investigation, when we are conducting investigations, whether it is bone marrow or FNAC, or when we are taking their specimens, we are consulting with patients, we are asking their reports. So we are dealing with patients. So ऐसा नहीं है कि आप हवा में ही बैठे हो एक कमरे में. You are the doctor who is giving a very definitive answer, yes or no वाला आंसर दे रहे हो आप. So a lot is reliant on it. And I think I should make a separate video on the several reasons why clinicians have been undermining the pathology branch for so long. Second myth, it's just slides that you're looking at all day. We are doing research. It is diagnostic dilemmas. You have morphology, you have IHC, you have molecular, you have NGS, and all of that data compiles together to give you the accurate most diagnosis so that guides the therapy, so that the clinician knows what is the best approach for this patient. Pattern recognition is a skill that takes years to develop. I hope सबको याद होगा कि अपने पैथोलॉजी सेकेंड ईयर में कितनी का आती थी सबको हिस्टोलॉजी. फर्स्ट ईयर में जो बनाते थे हम, हाउ मच यू रिमेंबर हाउ दैट शोड अप इन पैथोलॉजी? यू डू नॉट रिमेंबर दैट एट ऑल. ओके. थर्डली ये कि बहुत बड़ा मिथ है कि पैथोलॉजी इज अ बैकअप जो मेडिसिन नहीं करना चाहते, जिनका रैंक अच्छा नहीं आता. सी, I'll give you my personal experience. I worked as an MO for a few years after MBBS when I was preparing for the NEET exam, and sometimes I was taking breaks, sometimes I was working on and off. And I worked in ICUs during that time. And let's just say it is not for me. Seeing death every day is not for me. And some people are actually made for that kind of work. Some people can do that. I don't think I am for that. And I had gotten pathology earlier also, but I didn't take it. But after like really grinding in the ICU and really informing people at that young an age, 23, 24, hardly an age where you know anything and you're informing other people that somebody important in their life has expired, making death notes and stuff. Let's just say that the next time I give the exam and my rank improved a little bit, I was like, you know what, this time I will take pathology. I don't mind. और मुझे गवर्नमेंट ही करनी थी, प्राइवेट मुझे नहीं करनी थी. दैट वाज आल्सो माय इशू. मेरे रैंक पे आप बहुत अच्छी रेडियोलॉजी, गायनेकोलॉजी जो भी आपको करनी है आप प्राइवेट से कर सकते हैं. सो दैट इज़ माय थिंग. ओके, दैट इज़ माय एक्सपीरियंस. एंड अ लॉट ऑफ द पीपल दैट माइट ऑल्सो बी देयर एक्सपीरियंस. ओके, बिकॉज दे आर लाइक, वो हैव सीन द क्लिनिकल साइड, जो एक्सट्रीम क्लिनिकल साइड है. मुझे अब थोड़ा बैलेंस चाहिए लाइफ में एज वेल. द सर्टन ट्रेट्स दैट कम अप एट द टॉप. सो देयर इज हाई नीड फॉर कॉग्निटिव क्लोजर, विच इज़ यू लाइक रीचिंग अ डेफिनेटिव आंसर. मुझे पता चाहिए कि इसका डायग्नोसिस क्या निकलने वाला है, क्या होने वाला है, क्या फर्दर एंड पॉइंट क्या है. ठीक है. Uncertainty is a puzzle. It's a puzzle to solve. Every diagnosis is a puzzle. Okay, that is, it's a nice thing. ऐसा नहीं है कि आज आपके पास एक पेशेंट आया है और आज ही आप उसको एक दवाई देके ठीक कर दोगे. ऐसा नहीं होता, ऐसा नहीं होने वाला. हमारे पास एक केस आया है, आई नीड इट्स रेडियोलॉजी, आई नीड द क्लिनिकल हिस्ट्री, आई नीड और क्या क्या डिटेल हैं, और क्या क्या इन्वेस्टिगेशन आया है. फिर मैं माइक्रोस्कोप में देखूंगी या मेरी जो इन्वेस्टिगेशन है वो कंडक्ट करूंगी. फिर माइक्रोस्कोपी, फिर आई राइट माई रिपोर्ट, आई रीड अप अ लिटिल बिट इफ इट्स अ कॉम्प्लिकेटेड केस, आई डिस्कस विद अदर पैथोलॉजिस्ट एंड आई डिस्कस विद द क्लिनिशियन, एंड देन आई विल रीच अ फाइनल एंड पॉइंट दैट सेटिस्फाइज माई अंडरस्टैंडिंग ऑफ द सब्जेक्ट of that case, and then I will give the diagnosis. Okay. Secondly, if you're very introverted, it is nice. It's a very introverted friendly branch. But I am not introverted. I'm quite extroverted and I enjoy it. So what do you know? A very senior consultant pathologist told me a long time ago when I was doing my residency. I was in third year. They said pathology is the kind of branch that humbles you. Every other branch gives you hubris. But if you're a surgeon, everybody knows surgeons have huge egos. Even in the people in the medicine side of branches, whether it is just medicine, pediatrics, what have you, everybody has an ego attached to them. Pathology is not that type of branch. One of the reasons that they've undermined is this is the branch where sometimes you need other people to validate your diagnosis, and you need radiology, you need the help of the patient themselves to give you an accurate history. Some without any awareness about yourself will burn you out. I have realized this, which is I'm like I have to know where is my limitation and where I can improve, where I can learn. So pathology naturally gives you the idea that there's no ego involved here. Why? Because आज आपने जो डायग्नोस कर लिया, हो सकता है आप कल 10 दिनों में कोई और डिफरेंट तरीके से वही केस प्रेजेंट कर लिया तो अपना आना डायग्नोस कर पाओ, या फिर आपने क्या पता हो 10 सालों तक वैसा केस ही ना देखा हो, और एंड यू फॉरगेट एंड यू हैव टू रीड इट अप अ लिटिल बिट. सो पैथोलॉजी एक ऐसी ब्रांच है, यू इट डज नॉट गिव यू ह्यूब्रिस. यू ऑलवेज रियलाइज कि अगर मैंने इतना सीख लिया तो इतना तो पड़ा है अभी सीखना, मैंने इतना सीख लिया तो इतना पड़ा है अभी सीखना. तो इट इज़ अ ऑलवेज कंटिन्यू ग्रोथ, continuous learning. You have to be, that's the fourth point. The cross-disciplinary curiosity is there. So as a pathologist, you have to be interested in the genetics, the IHC, the molecular findings. I am really interested in that. I like research also. So you can't just be histology या अपनी केस देखे. Most of the लोग यही करेंगे, फ्यूचर में कर भी रहे हैं यही लोग काफ़ी, कि स्लाइड देखो, काम करो, साइन करो, भाड़ में जाए. I think it's a little bit above that. I think there's a little bit more leaning into it, and it's not just histology, it's not just a report that you're signing. Some people do the other way, which is ये जो लोग जल्दी जल्दी साइन करके ख़त्म कर देते हैं ना, what they do is जो क्लिनिशियन कह रहा है वही कर देते हैं. भाई जो क्लिनिशियन कह रहा है, I am not finding it on my slide, I'm not finding, those are not my findings, so why will I give that? So I have seen that also, which I find very icky. I don't know what to talk about that, but yeah, I told you the truth. Primarily डॉक्टरी फाइनेंशियल रीजंस के लिए करी है, तो आई डोंट थिंक दिस माइट बी फॉर यू. तो फिर आप दूसरी किसी ब्रांच पे चले जाना, और या फिर MBBS के बाद भी कहीं लग जाना. Significant anxiety around being wrong, and you always want to be right. That will be tricky for you. That will be tricky for you. I had struggled with this, but I was 26, 27 year fresh resident, so that age it's okay. But अगर आप हर फील्ड में, हर चीज़ में, लाइफ में कभी आपको लगता है गलत हो ही नहीं और आपको बहुत बहसबाजी करने की आदत है, एंड यू आर नॉट एबल टू लिसन टू द अदर पर्सन, देन दिस माइट नॉट बी फॉर यू. ठीक है, मतलब you have to have a clear way of managing, or at least learning how to manage, which is what I did whenever I struggled with, oh, I'm wrong here, which is, oh, I am wrong and I want to be able to not do that mistake again and learn from it. This translates to every branch. Almost everything I say translates to every branch, but I'm talking about from the pathology context. I mean, if you're still confused, or if pathology is for you, like, go out, go to the lab, go to the hospital, go to a private lab, go to anybody you know. I would advise go to a government hospital, see the functioning, and then decide for yourself, right? And you can ask the residents, what do you think? Do you like it? What is the good part? What's the bad part? And see, choosing a specialty is an important decision, right? You don't want to make it by default just because आपका rank आ गया है. You have to have proper context as to why you're choosing it. Sorry. You want to have proper context as to why you're choosing it, and you don't want to make the decision based on somebody else's prestige, and you want to make it like a genuine decision by exploring what is right for you, wrong for you. And I would say exposure is the best thing that will help you make the decision, because बाकी ब्रांचेस में ना आपको फिर भी एक्सपोजर मिल जाता है. इंटर्नशिप में, पैथोलॉजी में आपको एक्सपोजर नहीं मिलता. हमने किसी ने इंटर्नशिप इलेक्टिव नहीं किया ना, स्टिल फिगरिंग इट आउट. दैट्स कम्प्लीटली नॉर्मल. जस्ट गेट more exposure, ask more people around you, ask people who are already doing it, or whatever branch you're interested in. Be more curious about people who be more curious about that branch, and ask people who are already in that branch. And that is all for this video. I'll see you in the next one. Bye.